yeses today, folks who are undeclared and have gone to yes. One of those is Congressman John Boccieri, a Democrat of Ohio. This morning he publicly announced his yes vote, and he's good enough to join us now. Why did you make that decision, Congressman?
Thanks, Rick. After the compelling stories that I hear from across the country, and especially in my district, I felt that this was the right decision. Too many families are finding the cost of health care insurance to be one medical emergency, one accident away from complete bankruptcy. I had 3 families from my district at the press conference today, and we highlighted the fact that many of them have been denied coverage.
Did you have to swallow hard to do this based on the fact that there's a lot of folks in your particular precinct who, in your district, I should say, who are opposed to your decision, and this could cost you at the polls?
Well, there are some folks who are not supportive, but I just got a call before I went on the air here from a Republican in my district that said thank you for the courage, for standing up and doing what you thought was right, and he wants reform. We are faced with a decision here. You know, do we pass an imperfect bill or do we do nothing? And those two decisions come at a cost. If we do nothing, the cost of health care is going to explode. Families are already struggling.
And what do you say then? What do you say then to Republicans who say, look, yeah, we want to do something, but this is the wrong time to do something? You know, we've got serious problems in this country with the economy, and what we should do is pass legislation to create jobs, not worry about health care now. We can worry about down the road. What do you say to them?
Well, for me, this was a jobs bill, Rick, because the largest employer in my congressional district is a hospital. And in my congressional district, there's $56 million of uncompensated care that's going to be recovered under this passage of this bill. That's money coming back to keep people working in our community. Too often, folks who don't have insurance wind up in the emergency room, and all of us pay 5 times more in the system. So that's going to actually save money and create jobs, too.
What was keeping you from making a decision? Why are you an 11th hour guy?
Well, I wanted to look at the final numbers at the Congressional Budget Office. I'm a fiscally conservative Democrat, and I believe that we need to have reform, but we need to do it in a way that doesn't explode the deficits, has cost containment, and goes after fraud, waste, and abuse.
Well, let me ask you about those CBO numbers, because the Republicans are coming back now, and they're saying, look, the problem with the CBO numbers is they're inaccurate because they're not including, among other things, $371 billion in spending for physician fees. They're not including the Cadillac tax on the high-cost insurance plans. That's going to kick in 2018. I know the president pushed it back. Do they have a point?
No, I think, by the way, the Republicans did not support some of those measures that we passed out of the House earlier in the year. But at the end of the day, I mean, the Congressional Budget Office is the holy grail of all the numbers that we
so you trust them?
Fiscal. I do.
Congressman, let me hold you for just a moment here. I understand we've got some breaking news coming in. There might be another vote. Steve.